Welcome back to Jersey Matters. I'm Larry Menti. There's a new treatment for depression that's gaining popularity in New Jersey because it doesn't require taking any medication. However, you do have to wear a helmet that looks like it's out of a futuristic movie. Jersey Matters' Dimitra Gregorakis explains.
Depression doesn't discriminate. 15 million Americans, men and women, young and old, suffer from this complex disorder that makes life unbearable. For many who have tried antidepressants and still feel in the dark, there's hope to get your life back with a new technology called deep transcranial magnetic stimulation, also known as TMS. Steve has struggled with depression for years, describing it as a dark cloud he couldn't find any lasting relief. After endlessly adjusting his antidepressant medications, only to endure horrible side effects, he needed a change and sought the help of Dr. Violina Frenkel.
And here's the thing about medications. As I said, it's each individual. I know this, like someone could take an aspirin and it works, and someone takes the same aspirin, it doesn't work for them. So everybody's chemistry is different. And eventually some of these medications don't work as well. So they need other medications. You see that on TV. If your antidepressant isn't working well, try adding this one. It's just like, where's it end?
TMS is approved by the Food and Drug Administration for people who cannot tolerate or benefit entirely from antidepressants.
The success rate that we have with antidepressants is so low at this point. Only 1 out of every 3 will go into remission, even though 50% of patients will respond, but only 30% will be back to their normal functioning lives.
Dr. Violina Frenkel is the Vice Chair and Chief of Clinical Psychiatry at Overlook Medical Center and is helping to treat depression in her patients, like Steve, with deep transcranial magnetic stimulation.
The way it works is it sends magnetic impulses to the brain, specifically to the left prefrontal cortex area. And that is the area that's known to be responsible for controlling your depression symptoms. And it activates the neurons that may not be working or not working well. If we think of depression as a circuit disease, right, everything is interconnected in the brain. So when we activate the depression area, other areas improve as well, even the anxiety areas and the cognition areas, because all those are interconnected.
You're so desperate because I felt like a chronic malcontent. I was never happy. And I had a lot to be happy about. I've had a very fortunate life, but I'm just never happy. And so what happened at that point is you're willing to try anything.
We joined Steve to watch him go through his TMS treatment therapy firsthand.
And as you can see, there are certain rulers here to give us dimensions so we're able to find the primary motor cortex. Once we find the primary motor cortex, we are then able to find the left prefrontal cortex, which is the area that's responsible for the treatment of depression. Once we find the motor threshold, what we do is now we're going to find the dose. So think of TMS as a medication, and every medication has a dose.
The noise you're hearing? Those are the magnetic impulses, similar to the ones used in an MRI machine. The noise, Steve says, isn't uncomfortable at all. Patients wear earplugs to help muffle the sound, but it is pain-free. Each session lasts roughly 20 minutes, at first requiring daily sessions over 4 to 5 weeks. And then it is scaled down to 2 to 3 times a week. Steve began noticing a difference 2 weeks into his treatment.
Not only am I more motivated to do things, I'm getting so much stuff done now that I've been wanting to do for years and years and years. And the other thing is that as it's going on and I'm feeling better about myself, I'm doing more things, I feel better about that, so it adds to the esteem. And I'm finding happiness in things like, I'm growing my front lawn again in front of my condo. Getting it down, putting the dirt and the seeds, and I'm getting excited when I see the little sprouts come up. That's strange. That's not me.
It's covered by most insurances. It's covered by Medicare and private insurances. Oftentimes when the patient calls in, we'll ask for their insurance information and we'll call to find out the benefits, and we'll get an authorization. As soon as that authorization is in place, they can get started.
For more information on TMS therapy and other treatments, talk to your doctor and visit brainsway.com. From Summit, I'm Dimitra Gregorakis for Jersey Matters.
All right, thanks a lot, Dimitra, and congratulations on your first report for Jersey Matters. When we come back, getting electric cars on the streets of New Jersey's largest city. That's when Jersey Matters continues.